Hi, I'm Dr. Tanner with Our Family Chiropractic, family wellness chiropractor right here in Fort Worth, Texas. Today's topic is herniated disc. Now, herniated disc is not the most desirable condition. It is very painful. It is a very serious condition. Now, with a herniated disc, we have to ask, why did the herniation actually take place to begin with? Not, yes, it's there. We have to figure out why was it there in order to be able to actually go to the root cause and the source of the issue in order to help your body respond well and possibly heal from this. Most common cause of herniation is going to be improper loading because of stuck and immobilized joints that may be even possibly slightly misaligned. From a chiropractic perspective, we have to make sure that those joints of every one of your bones in your spine, there's 24 of them, right? From the base of your skull to the top of your pelvis, all of those bones have to be moving appropriately. Herniations in the spine typically happen in the neck, specifically the mid and lower portion of the neck, and then also the mid and lower portion of the low back. So C5 in the middle portion of the neck is the most common, and then so is the L5. So L4, 5 as well. Also, if there's a herniation or a swollen disc, that can cause the sciatica, right, that we all talk about. But then we have to figure out, let's go back to herniations themselves. When that joint, or those two bones that come together that sit right on top of the disc, when those two joints are not moving the appropriate way or the proper way, that unloads some portion of the disc and loads up greater forces on the opposite side of the disc, and that's where we have tearing and protrusion and explosion basically, or collapse of the disc from that side. So if you don't have proper alignment and allowing those joints to sit right on top of each other, if you have one that wedges one way or the other, or forward or backward, that can cause compromise. Think about the disc itself as like a jelly-filled donut. If I press on the front edge of that disc because I've got collapsed posture, I'm going to be pressing here and the jelly filling is going to shoot straight back, and that's where my nerves are. That's why the herniation is so powerful at buckling you and making you weak and making you feel tons of pain, because it pushes straight into the spinal canal and also directly onto those nerves. Not to mention the chemical that is inside of the disc. Once it gets outside of the disc, it has a lot of tendency to pull extra water, extra inflammation into that area, which causes even more pain and pressure to those nerves. Now, what can you do about a herniated disc? Well, first things first, we have to make sure there's good motion there. If there's not good motion, there's nothing that's going to help. Yes, you can medicate with pain medications and stuff like that, but the source of the issue will never be resolved. Now, some people will say that decompression is the one and only thing that you can do. Now, some people actually don't respond well to decompression. Now, I do know that in our office, we have tons of patients that have already had herniated discs that unfortunately had already gone down the surgical route, but then they come back and they still have issues like that. So we have to figure out why and where and how do we actually go in there to fix this. So once we reestablish good ranges of motion, because once we find that one particular area that's not moving right and we get it moving, we unload the pressure on the disc. We actually now evenly disperse, you see here like between my hands, we evenly disperse the forces all the way across that disc, and it allows that disc to refill. And a process called imbibition is actually the pumping mechanism. Think about like a hydraulic pump or a jack type of thing. If you're jacking up a car, the more fluid that we actually get in there, the greater that disc is going to gain height, and it's not going to compress on those nerves anymore. It actually sucks some of that disc material back in. There are tons and tons of ways to look at this, but every specific case is very different. We have to figure out what orthopedic and what neurological tests do we need to perform on you to make sure that, number one, you're safe to adjust, but then number two, which direction do we need to be adjusting in? And we probably need to take x-rays to make sure there's not any actual bone damage. And there may be a need for MRI and things like that to be very diagnostically specific if there are some severe radiating types of symptomatology. So radiation of pain, numbness, weakness, those types of things, inability to breathe, to control your bowel and bladder function, that type of thing is going to be an emergency case. So there are many things that we do take into consideration when we go in to actually apply a good diagnostic thought process. We need to make sure that your health is preserved as great as it can be. So if you have, or you think you have, a disc herniation, whether it be in the low back or in the neck or maybe even in the mid back, although rare, you let us know. Click the link below, give us a call, let's set up a consultation, let's get you in the office and let's figure out what this is, where do we need to go in, and where do we need to fix it, and how do we fix it. I look forward to helping you soon. If you're not here in the Fort Worth area, you let me know where you are and I'll find you somebody to help you get back to where you deserve, which is thriving, not just surviving. I'm Dr. Tanner once again, guys. Y'all have a great day. Bye-bye.